My name is Dr. Desireh, and I manage the UNITWIN and Provision Program at FIP. I'm pleased to be co-moderating with Dr. Hanadi Alolimi, and I welcome her to introduce herself and share some brief housekeeping rules. The floor is yours, Hanadi.
Thank you very much, Genuine, for the introduction. Hello, everyone. My name is Hanadi Alolimi, and I am the UNITWIN and Provision Program Coordinator at FIP. It's a great pleasure today and honor to be part of this important event. Next slide, please, Genuine. So before we begin, I would like to share a few housekeeping announcements. First, this webinar is being recorded and live streamed via YouTube. This means that your colleagues who are unable to attend today will be able to access the recording later. The recording will be available on our website at www.events.fip.org. You are welcome to ask questions at any time using the question box provided on Zoom. We will address as many as possible during the Q&A session. And we also invite you to share your feedback with us at webinars@fip.org. And finally, if you are not a member, we encourage you to become a member of FIP by visiting www.fip.org/membership_registration. And we would be delighted to have you join our global pharmacy community. The next slide. For our international participants, we are pleased to let you know that live translation captions are available on Zoom. There are just 3 simple steps to enable them. Step 1 is to turn on caption by clicking the CC icon at the bottom of your Zoom screen. Step 2 is to enable the translation toggle under captions and translation. And step 3 is to choose your preferred language under my caption language. Once you have selected your language, you will be able to follow along easily with live translated captions throughout the event. For our Spanish-speaking colleagues, you can switch your caption language to Spanish and enjoy live translation throughout the session. If you face any technical issues, please reach out in the chat box and we will be happy to assist you. Here in this slide, we have our distinguished panel of speakers, each representing a global network of leaders in pharmacy education and science transformation. Those experts have joined us today to foster collaboration and drive progress through the launch of the FIP-UNESCO UNITWIN Center for Excellence in the region of the Americas. Throughout this session, we will introduce each speaker individually so you can discover more about their impressive work and the valuable perspective they bring to advancing pharmaceutical education and science in this region. The next slide. By the end of this session, you will be able to first explain the purpose, vision, and strategic priorities of the region of the Americas for the Center for Excellence in Pharmacy Education, Science, and Practice. Second, you will identify the key challenges, emerging needs, and priority actions for our region, drawing on insights from existing FIP Global Pharmaceutical Observatory data and the America Strategic Roadmap Insight Board report. Third, you will recognize the existing stakeholders and partners already working with the region and highlight successful regional best practices that can inspire and guide future initiatives. And finally, outline the next practical steps for engaging with the Center for Excellence and contributing to regional initiatives, including opportunities for FIP academic institutional members and other partners. To the next slide, I will present a quick overview of our event program. As we have already begun with introductions from both myself and Genuine, and this will be followed by opening remarks and a message from our FIP Chief Executive Officer, Dr. Catherine Toggen. Next, you will hear from Professor John Pieper, who will be providing an overview of the UNITWIN program and details about the strategic roadmap for the region of the Americas. Following this, Professor Lilian Azzopardi will give insightful information about the academic institutional membership, and Professor Silvana Lete will formally launch the FIP UNESCO UNITWIN Center for Excellence in the region of the Americas. We will then move forward into our panel discussion, where our speakers will explore how collaboration, networking, and educational development can transform pharmaceutical education and science across the region. To wrap up the session, Dr. Dalia Bajes will deliver closing remarks. So with this, I would now like to hand over to my colleague Genuine Desireh, who will provide us with a brief snapshot of our collective journey toward enabling pharmaceutical education and science transformation. Thank you very much, Genuine. Over to you.
Excellent work, Hanadi. Thank you for covering those important housekeeping rules. So as I earlier mentioned, we of course gathered here today to continue a journey that began more than a decade ago. And to just give you some context, the UNITWIN program started with the African Center for Excellence in 2010, which laid the key foundations and developed resources that continue to guide and strengthen the program to this day. And building on that success, we then launched the Southeast Asia and Western Pacific Centers for Excellence in 2023 and 2024, respectively. And this builds on the renewal of our partnership agreement with UNESCO. These two centers, of course, have quickly followed the strong example that was set by the African Center, and they are already making remarkable progress when it comes to developing resources and initiatives that enhance academic capacity, improve patient safety, and also support competency development across their regions. This success is, of course, driven by the dedication of many of our volunteers from our academic institutional members and by the unwavering commitment that they have to advancing pharmaceutical education and science. We're now well on our way to completing the global network of Centers for Excellence, starting with the launch of the Eastern Mediterranean Center, which we launched on the 28th of October. That's a few weeks ago. And now the region of the Americas is being launched today. As we'll hear from our speakers and panelists, the UNITWIN program is truly a unique platform, one that delivers meaningful, measurable outcomes that are aligned with both regional priorities and FIP's strategic plan. We look forward to welcoming more institutions to join the existing Centers for Excellence within their regions as we continue to expand and amplify the impact of this transformative initiative. It is now my honor to welcome our CEO, Dr. Catherine Duggan, to provide some opening remarks. You're welcome, Catherine.
Thanks a million, Genuine, and thank you everyone for being here today. As Genuine has mentioned, my name is Catherine Duggan, and I am the Chief Executive Officer of the International Pharmaceutical Federation, FIP. It's my great pleasure to welcome you all today as we mark a significant milestone in transforming pharmaceutical education and sciences across the region of the Americas. We are launching the FIP-UNESCO UNITWIN Center for Excellence in the region of the Americas, a milestone that reflects many years of shared commitment and collaboration. The UNITWIN program has been a remarkable journey, starting, as Genuine mentioned, from the first center in Africa. Being the only global pharmacy body, the only professional body globally with this relationship with UNESCO, we have seen profound benefits of creating the platform for twinning universities to exchange knowledge and adapt pharmaceutical education and sciences to emerging regional needs and priorities. Building on the successes in Africa, we launched the Centre in Southeast Asia in October 2023, in the Western Pacific region in May 2024, and most recently in the Eastern Mediterranean in October last month, bringing academic institutions to work collectively on pharmacy, education, and science. The Americas region is at a pivotal stage of reform in pharmaceutical education and sciences, challenged by misalignment between curricula and real-world practice, the need to address gaps in experiential training, limited interprofessional collaboration, and underinvestment in faculty development. There is therefore a pressing need to adapt education to healthcare demands, to update curricula with case-based learning, and prioritise CPD, continuous professional development. The FIP-UNESCO UNITWIN Centre for Excellence in the Americas will serve as the regional hub to unite FIP aims, academic institutional members and partners, and offering a systematic approach to advance education, science and practice in alignment with the FIP strategic plan and the agreement that we have in place that takes us through to 2027 with UNESCO. Building upon the insights from the 2025 FIP-UNESCO UNITWIN Strategic Insight Board report and linked to the global efforts through the FIP development goals, the Centre is designed to empower academic institutions to meet current and future educational challenges in the region. It's important to recognise that the Centres for Excellence serve as a primary mechanism for establishing FIP's regional focus in pharmaceutical science and education, and champion our priorities and initiatives at the regional level in collaboration with our regional pharmaceutical forums and other key FIP stakeholders on relevant pharmaceutical science and education matters. These initiatives and priorities are anchored by the FIP strategic plan, which takes us through to 2030, and guided by our development goals. As we look forward to the future, I encourage everyone here to consider how you can engage with this Centre for Excellence and contribute to its success. Together, let us realise the extraordinary potential of working collaboratively to transform health through pharmacy education and science. With your expertise, your commitment and your cooperation, I'm really confident that this Centre for Excellence in the Americas will become an inspiration for innovation and progress in pharmacy education and science worldwide. Thank you all so much, and I look forward to the fruitful discussions and inspiring contributions that will follow today and into the future. Have a great event, and congratulations on your launch.
Thank you for those remarks, Catherine. And now we will move on to our first presentation, which will be from Professor John Pieper, who's going to share with us a more in-depth overview of the UNITWIN program and the journey it has taken to get here. John is the President and Professor Emeritus at the University of Health Sciences and Pharmacy in St. Louis. He has been a lifelong leader in pharmacy education and has served as the President of the FIP's Academic Pharmacy Section, and is also the current chair of FIP Education. A past president of the American College of Clinical Pharmacy, John is also a fellow of ACCP, the American Pharmacists Association, and FIP. Welcome, John.
Thank you very much, Genuine, and it's a pleasure to be here to talk about the overview of the UNITWIN program and the process by which the Americas region was able to develop a strategic roadmap. Next slide, please, Genuine. So a little bit more detail about this relationship with UNESCO. As you know, UNESCO is the United Nations Education, Scientific, and Cultural Organization that is an agency of the UN that promotes education, science, and cultural collaboration across the 194 member countries of the United Nations. The UNITWIN program began along with the UNESCO Chairs program in 1992. And the purpose is to foster international inter-university cooperation that matches experts in universities with other universities that are looking to grow in certain areas. And the UNESCO UNITWIN Chairs program now involves over 120 countries that has been strengthening institutional capacity through knowledge sharing, research collaboration, and innovative educational networks. The vision of the UNITWIN program is to transform pharmacy and pharmaceutical sciences education and research, advancing sustainability of programs, equity, and technological innovations in the pharmaceutical sciences through this inter-university collaborative twinning of relationships that provide and promote excellence across all regions of the world. The mission then of the UNITWIN program is to advance global pharmacy and pharmaceutical sciences education, through this collaboration, this twinning network of research, training, and quality assurance, developing academic capacity and workforce competency. Next slide, please, Genuine. The objectives of our FIP-UNESCO UNITWIN program is, first of all, to lead educational and scientific transformation by promoting this collaboration among universities to address sustainability, inequities, and technology. Secondarily, a second objective is to enhance the integrated system of research, education, training, information, and documentation activities in the field of global pharmacy education, addressing issues of academic capacity, quality assurance, and workforce competence. Thirdly, to cooperate closely with UNESCO and other UNESCO chairs and UNITWIN networks where appropriate on relevant programs and activities. And lastly, to contribute to the improvement of global health through this twinning of universities in this way. Next slide, please. So there's a nice alignment of priorities for FIP, the WHO, the UNESCO program, regional priorities, and our calls to action. On the FIP side, global health priorities for FIP include patient safety, non-communicable diseases, universal health care, digital transformation, sexual and reproductive health, and emergency preparedness. The WHO Global Workforce Strategy focuses on health programs, self-care, and human resources for health agendas, protecting and investing in healthcare workers, on the code of practice for international recruitment of health personnel. The FIP-UNESCO UNITWIN network has the objectives that I've just talked about, kind of in summary, linking our workforce, gender and equity, and humanitarian curriculum together in a twinning relationship. The regional forums also exist based on the WHO regions, and certainly there's a focus on these centers of excellence to work closely with the regional forums, and more about this from Magaly later. And lastly, there are some call to actions from FIP that will impact this Center of Excellence program. Next slide, please. So just a little bit about the history. You've heard of this. So our FIP UNESCO UNITWIN program is unique among all health professions, and in fact, all professional programs. It was established in 2010 as the FIP UNESCO UNITWIN Global Pharmacy Education Development Network, which led in 2010 to the initial launch of a Center of Excellence in Africa. In 2014, an agreement was reached with UNESCO to transition that initial agreement to be one of a global pharmacy education development network. 2016 was remarkable in that there was the historic FIP Global Conference on Pharmacy and Pharmaceutical Sciences Education in Nanjing, China, which led to the development of the Nanjing Statements, which have served FIP well in multiple institutions across the world as competency statements to follow in program development. In 2018, a needs assessment, renewed strategy, and restructuring of the program again occurred for the Center of Excellence in Africa with a strategic meeting held that year in Lagos, Nigeria. 2019 was remarkable for the progress of the Center of Excellence in Africa and a strategic meeting in Mombasa. 2020 marked the launch of the FIP Pharmacy Education Center in Sub-Saharan Africa report, which was really for the first time a clear documentation of competencies and development in Sub-Saharan Africa. Next slide. In 2021, FIP UNITWIN launched a Pathfinder toolkit, which is still available. This toolkit was a description of roadmaps for the 6 WHO regions and a call to action for advancing pharmacy education. In that 2021-22 timeframe, virtual regional workshops were held, global summits held, and these regional roadmaps developed. And I'm going to review that roadmap for the Americas in just a moment. In 2022, FIP launched a toolkit for addressing inequities and an FIP education transformation toolkit. In 2023, there was a renewed agreement with UNESCO to carry us, as Dr. Duggan has pointed out, through the year 2027, with the priorities are to launch these 6 regional UNESCO UNITWIN twinning centers across the world, to implement the regional roadmap work, and finally to establish an African-wide association of pharmacy schools. And in 2023, as was previously mentioned, UNITWIN launched its 2nd center in Southeast Asia. 2024 saw the launching of an exciting center in the Western Pacific. An FIP Global Competency Framework was developed in Southeast Asia, and a UNITWIN strategy as a key governance structure for the UNITWIN program was developed. And now in 2025 is the launch of the remaining centers in last month in the Eastern Mediterranean, today the Americas region, and in December the European region. Next slide, please, Genuine. So a little bit about this 2021 UNITWIN roadmap, which is really divided into 2 sections, North America and Central and South America. For North America, the 3 FIP developmental goals and objectives are policy development, academic capacity, and continuing professional development strategies. These are the same development goals and objectives for Central and South America as well. But the objectives and action plans are different for North America versus Central and South America. In North America, under policy development, the objective is to develop a policy that enhances the scope of practice for pharmacists in North America through resolving issues with governments around provider status. The action plan is to provide a platform through UNITWIN to bring authorities, associations, accrediting bodies, and academia together to develop these policies that will enable an expansion of scope of practice for pharmacists. Under academic capacity in North America, the objective is to develop regional initiatives that helps attract young people to enroll in pharmacy schools and to expand pharmaceutical sciences and practice through expanding opportunities for pharmacy students. The action is to create awareness and broaden information about the opportunities for students as they graduate from pharmacy programs and for pharmaceutical scientists. Under CPD, or continuing professional development strategies in North America, the objective is to develop programs to support return to practice after taking a career break for more senior pharmacists, and to develop self-assessment tools is the action plan that has initially been proposed. Next slide. For Central and South America, the objective areas are the same, but as I said, the objectives themselves and the actions are somewhat different. In the policy development area, the objective for Central and South America was to amend existing pharmaceutical policies in favor of professional recognition of pharmacists as a requirement for wherever drugs are dispensed and used. The action is to host regional roundtable discussions, including academia and professional associations, to advocate for professional recognition. Under academic capacity, the objective was to develop regional, interregional academic capacity building initiatives between North America, Central and South America for faculty and staff development, particularly in the areas of clinical pharmacy, pharmaceutical care, and public health. The action then was to establish quality standards for interprofessional and multidisciplinary education, experiential learning, and strategies around metacognition and hybrid teaching methods by publishing a guidance toolkit. Under continuing professional development, the objective was to promote CPD strategies and self-directed learning. And the action was to develop a series of webinars in collaboration with other universities that are in the center to promote CPD strategies and self-directed learning, and again, to establish alliances between universities, health authorities, and professional organizations. Next slide, Genuine. So, emerging from the Insight Board were challenges and needs that were identified. The challenges and emerging priorities in the American region, now this is combining North America, Central and South America. The key challenges are there's a misalignment between pharmacy school curricula and real-world practice. There's a lack of sufficient experiential and practical training sites for students, limited interprofessional collaboration between physicians, nurses, dentists, and other health professionals and pharmacists, and a lack of harmonized accreditation standards for pharmacy programs in the region. There's been an insufficient investment, financial investment, in faculty development and leadership training. There has been an overburdened educational institutions who've been overburdened with limited incentives for curricular change and innovation. And lastly, there have been gaps in continuing education for practicing pharmacists. Next slide. On this next slide is really some emerging priorities then based on these needs. The emerging needs and priorities are adapting education to current and future healthcare demands, to update and to facilitate updating curriculum to more case-based and experiential learning, strengthen regional collaborations among universities, to prioritize leadership training, develop a strategic roadmap with inclusive regional engagement, and to align continuing education. To be able to do all of these things will require collaboration between two significant groups who need to be a part of this center. The first is our national and regional associations of faculty, schools, departments of pharmacy, such as the American Association of Colleges of Pharmacy, the Association of Faculties of Pharmacy of Canada, PAHO, COIFA, and other regional associations of schools of pharmacy. And it's certainly the priority of this center to have representatives from each of these groups serving on an executive committee to provide that input. The second major collaboration to make this happen is with our regional forums. And each of the 6 World Health Organizations, in addition to having this center that includes academic institutions, are the regional forums that have been established, and close collaboration between the regional forums that are made up of the professional associations from each of the countries in a region, working with the academic institutions in that same region to tackle these problems. And the third and last thing I'm going to mention before handing this off to Dr. Azzopardi is currently there's a requirement for institutions to be in this center of excellence that they be a member of the academic institutional membership of FIP. I think as we have thought through this, there are going to be a number of schools who either financially can't commit to that membership fee or are not at a point where they feel comfortable doing that. And we recognize that, and we're going to work closely with all of our institutions across the region to work out an arrangement where a membership can be made more available, non-members can be fully engaged. And I'm committing to take this to our membership advisory committee and to the governing bureau of FIP to make that happen. So with that, I am going to say thank you for your attention and turn it back to Genuine.
Thank you so much, John, for that insightful overview of the UNITWIN program, and of course, the vision and the intentions that we have as we set up the Center for Excellence in the Americas. Moving on to our next distinguished speaker today, we have Professor Lilian Azzopardi. Professor Lilian Azzopardi is a professor and head of the Department of Pharmacy at the University of Malta, and she's also the chair of the faculty's doctoral committee. She has led major developments in pharmacy education globally and co-chaired the working group that developed the FIP Nanjing statements that John has just referred to. She currently serves as the chair of FIP AIM. Welcome, Lilian.
Thank you, Janwin, and thank you for the opportunity to present insights related to the membership, the benefits, and the activities that go on when a School of Pharmacy is a member of the FIP Academic Institutional Membership Group. It's also very exciting for me to be in the session, joined by a very large number of colleagues coming from the Americas. So it's a nice afternoon to spend with colleagues. Moving on to the next slide, I'd like to therefore introduce, this is a snapshot of the membership map for AIM. The schools of pharmacy are a member, and then the leadership teams are actively involved and connected within our network. As you can see, there's also the opportunity to, if you scan the QR code, it leads you to information and leaflets and information about the activities that go on in AIM. I'd like to also point out that the opportunity that AIM brings out is that as a School of Pharmacy, the school is a member of a global network, which gives you the opportunity that not only looks at the region as the UNITWIN Center of Excellence is providing, but within AIM, it's a platform then to connect with other schools of pharmacy all over the world. And I must say that around 25% of the members of the schools of pharmacy, which are members of AIM, are actually coming from the Americas region. In the next slide, we highlight here the strategic plan for AIM for the group is based on emphasizing the opportunities that we communicate across the members, and it's also a line of communication that strengthens network collaboration for research initiatives between the members, also other project initiatives, student mobility, staff exchange, connection of having collaborations nowadays supported very ably through the digital platforms. And of course, it's also a way of being part of activities in AIM and within FIP, including, as has been explained earlier by John, also through these centers of excellence. The third area of focus for AIM is that we also work as the leadership teams in the different schools of pharmacy to provide tools and deliverables that are useful for each one of us. We dedicate every year, we have an area of concentration where members, AIM members are also asked to nominate colleagues who would like to join these working groups. And within the working group, members can showcase, bring to the front their experiences, good practices, and then we are all learning and networking from each other. And in the next slide, I can give you an example of an area of concentration that the AIM team and colleagues from around 22 different institutions have been working on in 2024. And with the work and the experiences and the examples that were provided from these colleagues, we have drawn up this toolkit, which is available. It's a report that is available for AIM members, for schools of pharmacy. They can share within their faculty. And in this example, the work that we were working on and which was launched last January was looking at examples and experiences of promoting research and postgraduate education. And there are over 50 examples of different enrollment pathways, financing mechanisms, and models that are being used in the different parts of the world. So it's an opportunity to put on the table and share experiences and also receive. And that is the beauty of having the school part of the AIM team, that you can provide your experience, and also learn and gain from the value that the AIM membership gives. In the next slide, we have other initiatives and activities that are offered to the member group, for which all the faculty in that School of Pharmacy can be invited to. We run webinars. There are webinars and sessions over the digital platform. Some are more informal. For example, this session, which was an exploratory conversation amongst representatives from members of AIM, where specific examples of research and postgraduate and entrepreneurship were shared. And in the more recent, in the next slide, you can see that last week, actually, we had a very invigorating webinar, which looked at entrustable EPAs and trustable professional activities. We were very privileged to have the father of EPAs, Ole ten Kate, from the Netherlands, who actually was the person who started EPAs in medical education. He was available and gave us a very insightful overview of EPAs and how they have developed also in our pharmaceutical education. And Ole was then joined on the webinar. We had very active speakers coming from the pharmacy world, colleagues from Kuwait and Canada, who actually brought forth their experiences, highlighting both the opportunities, but also, of course, very important, the challenges, and how can we all learn and adapt from these ideas back to our setting and to our school. So these are examples of digital events that are geared at addressing ongoing activities and important aspects that we are all facing from the leadership teams in our schools of pharmacy. Additionally, in the next slide, we share, these are snapshots from the very successful session that was held in Copenhagen. So every year during the annual FIP Congress, AIM brings up a Global Academic Leaders Forum. It's a session that's specifically built around the needs of academic leadership teams in schools of pharmacy for our AIM membership. Over here, you can see, I can also highlight and spot Silvana in the top corner of the slide. Silvana was one of our very active committee members for AIM, and now we are very ably joined by Wanda on the team. So in the AIM advisory group, we have representatives that are bringing in the needs from the different regions, including in this case, the Americas, where we have both Pieper and Wanda representing the Americas on our team. And during the Gulf session, we bring up a workshop, an interactive workshop that again addresses areas which we know from our membership are areas that have a global interest and which can then also provide each one of us with insights that we can carry back home. And in Copenhagen in last September, during this Gulf session, this was dedicated to entrepreneurship and collaboration in pharmacy research, education, and clinical education. The next slide brings up another activity that is handled through the FIPED activities, but where AIM members have the opportunity to have a spotlight. This is the FIP World List of Pharmacy Schools, which holds, it's an initiative that FIP runs in collaboration with the World Health Organization, where all the schools are listed. However, for the AIM members, there is the opportunity that you can populate the profile for the school with additional information that could serve to create visibility to activities of research or postgraduate education or other opportunities that the school would like to showcase. So it's also the QR code is there to take you to this list, and you can navigate through the information that you can find and retrieve if you want to connect with colleagues. But it also is demonstrates the opportunity that AIM membership gives to the school in terms of visibility to promote your scholarly activities. In the last slide, I'd like to also share with you the very recent initiative that has been started for AIM. It's an electronic newsletter, AIM Connect, which we launched last month with the release of having biannual issues. And the newsletter is an opportunity for member schools to provide updates, but more importantly, it's the forum where we are going to also provide information that is happening in FIP communities that is relevant for schools of pharmacy, including, and we are looking forward, of course, to have information coming from the UNITWIN Centers of Excellence. And we look forward, I do really look forward to have the opportunity to connect and communicate and learn from the Center of Excellence for the Americas, and that with that information and those activities that you generate from the Center of Excellence, how we can feed that back in to AIM, share it with our membership through the newsletter, but also I look forward to have collaborations and to, on a global level, of course, move forward with the information that's provided and how we can share this experience together. So thank you again, and I really look forward to the connection that's going to be supported from this Center of Excellence.
Thank you so much, Lilian, for that overview of AIM and the many, many benefits that our AIM members get as part of their being part of this academic community. Now I will hand it over to Professor Magaly, who is an Associate Dean for Clinical Services and Practice Transformation, and also the Executive Director of the Center for Innovative Pharmacy Solutions at the University of Maryland School of Pharmacy. She also directs the Maryland P3 program, which is a pharmacy-led initiative delivering comprehensive medication therapy and chronic disease management across the Mid-Atlantic region. Interestingly, Magaly is the past president of the Regional Pharmaceutical Forum of the Americas, and she's going to share with us a brief overview of the Regional Forum as a key partner in pharmaceutical education and science transformation in the Americas. Welcome, Magaly.
Thank you so much, Genuine, and good morning for some of us, good afternoon, and good evening for many of us. It's really for me a pleasure to be here with you today as a proud past president of the FIP Pharmaceutical Forum of the Americas, and also wanted to let you know that I have been for many years also, and I am part of the executive committee of the Pan American Conference on Pharmacy Education. So through both of those efforts, I have had the pleasure to really work with many of our colleagues that are here present today, not only across the world, but also in the Americas, to really work on pharmacy education and seeing how we all collectively could really transform and help move the profession of pharmacy forward, particularly focusing on education. So with that, in the next slide, I wanted to take a couple of minutes just to introduce you all and level set about the Pharmaceutical Forum of the Americas. think it's important for all of us to understand what are the objectives, the structure. So the Pharmaceutical Forum of the Americas is one of the oldest, if not the oldest, pharmaceutical forum across the world. And it was actually founded in 1999. And this forum was really a collaborative effort between the Pan American Health Organization and also many of the pharmacy organizations in the region, including FIP, but also 3 regional and 14 national organizations. Through all of these years, since 1999, we really have been working very hard to bring in the voices of all the different stakeholders in the region in collaboration with FIP to develop various projects, launch a call for proposals and different activities, not only in pharmacy practice, but also in pharmacy education. We have done this, next slide, really with the focus of our goals, which is to support health, not only at the global, but also regional and at the country level by enabling and advancing, like I said, these 3 pillars, which is pharmacy practice, science, and education. And with this, in the next slide, we're going to see that one of the major transformations that our center, our forum has really gone through is 2 years ago, all forums really became an integral part of FIP. So as you all know, the forums across the world are part and are organizationally part of FIP. They're not separate structures. So as such, these are the objectives that we have as part of the forum. One is, like I've been alluding to, is improving the health in the region, again, contributing to making sure that patients get the services that they need, not only healthcare services, but particularly pharmaceutical care services, through the development and improvement of pharmacy practice, pharmaceutical science, pharmacy education, with a very important focus and goal in workforce development. And we're going to talk a little bit about later when I talk to you about a project that the forum has undertaken in the last couple of years, that we're focusing a lot in how do we develop the workforce to meet the needs of our patients, to meet the needs of the citizens of the region, particularly with a focus on primary care. We also support the implementation of projects that are aimed at advancing pharmacy practice, pharmaceutical sciences, and education in partnership with different organizations across the regions. One of the things that we've been doing for many, many years is that we do call for proposals to really finance innovative projects across the region. And one of these projects that we have done in the last couple of years is partnering with the Pan American Conference on Pharmacy Education to align efforts. So in that way, we can work collaboratively and in unison in really promoting and advancing pharmacy education in the region by us giving the members the opportunity to really do innovation in various areas. And again, part of a very important role of the forums is really to disseminate, promote, and really make sure that we align FIP and the World Health Organization, and in our case, the Pan American Health Organization's policies at the regional level. And doing this, we have participated in the last probably 5 years, working very closely with PAHO in a project that is really looked at the implementation of indicators for pharmacy services across the region, making sure, again, that a lot of what we do is aligning the efforts that are already existing and making sure that we amplify them, as well as amplifying a lot of the FIP development goals and the FIP goals worldwide, but also at the regional level. And in the next slide, we can see that this structure of the forum has an executive committee. As I genuinely alluded to, I had the privilege to serve in the executive committee for many years in the forum, but last 2 years as the president. But I wanted to share with you, these are the leaders that are part of the executive committee for 2025, 2029. Many of them are here with us today. And so again, we do have representation across the region in terms of making sure that the executive committee reflects our membership across the region. Next slide. With that, one of the things that we started doing in the last couple of years was really trying to develop projects and trying to develop initiatives that really focus on the biggest challenges we were seeing in the region of the Americas. And one of the things that really came to light for us is really the inadequate legislative and regulatory framework that we see across the region. So you see one country, you see one country. There's so much variability, not only in terms of pharmacy education, but also in the requirements and legislative and regulatory framework for pharmacy practice. Particularly, one of the biggest challenges we have identified is really regulatory and policies that really dictate that a pharmacist must be present in a pharmacy, particularly in community pharmacy. We also saw that there are some limited scope of competencies and activities across the region. And again, there's a need to really, through workforce, through education, to improve some of the competencies and the clinical activities that pharmacists are doing across all the settings within the healthcare system. And so there seems to be a disconnect between really the clinical focus on pharmaceutical education and practice and really within the curriculums. And we're going to talk a little bit more about that in the panel discussion, but we really see that there is not a great alignment between the healthcare needs, the pharmacy needs of the country, and the workforce that we're developing and the product that we have as pharmacists with the curriculum. And so we've been doing a lot of work to trying to align that. And really another thing that came to light is the insufficient manpower or workforce. And we're going to talk more about that later too. But in many countries, we're going to see in a minute that there's really not enough pharmacists or not enough faculties of pharmacy to really produce the number of pharmacists that we need in that country to really achieve the goals of these strategies that we have in mind. So in the next slide, I wanted to share with you, we have done, like I stated, many activities and projects throughout the years in the forum. But I wanted to focus the rest of my time really talking to you about this very exciting strategy and innovation and project that we started 2 years ago, which is really once we thought about what are the challenges in the Americas, what's happening, look backwards to many of the projects that we implemented and many of the advances. One of the things that we really realized is that we needed to do it in a more informed, but a more cohesive way to see how we were going to move forward. So we developed this project that is the roadmap for the advancement of pharmacy in the region of the Americas. And again, the goal of this project really was to develop a strategic document. So it was a strategic document that gave us a guidance where we want to go, what needs to be done, with the goal that once we identify the needs and priorities of each country will have the information they need to develop the priority listing. So the idea here is that this roadmap will inform us about how to develop pharmacy practice in the region, but also give each country specific guidance, assistance, and collaboration from the forum and FIP and all the other stakeholders in the region to develop these priorities. So each country can develop an action plan that really pinpoints what are the greatest need within that country. For example, in a country, it may be that the priority number one is regulatory. In another country, maybe priority number one is workforce development. In another country, maybe training of existing pharmacy workforce. So the roadmap, the strategic document will guide us into that. And again, this will be shared across the region, shared with all the different organizations, professional, educational, with PAHO, with the Pan American Conference of Pharmacy Education and others, but also I hope with the center. This center will be crucial in really helping us in this journey. The next slide. So with that, what is contained in this roadmap? So these are, again, high level, but really our goal is to create a clear vision for the profession. Really, what are the strategic objectives that are aligned with the FIP, setting the goals, and really an initial diagnosis for each country. And as part of this initial diagnosis, next slide, one of the things that we really have put into place is developing the strategy that really focus on these items in the slide. Population health needs, what are the skills and capability that we need to create a primary care health force, ensuring that we do the right training and identify what are the capacity and skills that we need based on these priorities that get identified. Next slide. So with that, the roadmap has 4 main components. One is this diagnostic component, and I'm going to share with you that one of the things that we had done with this is to conduct a survey of all the countries in the Americas to try to determine through information in that survey, what are some of the capacity that exists, what are the educational framework, regulatory framework, so we could really learn what's happening. We didn't want to develop action plans that didn't have as a base information of what exists to happen. Develop the strategic planning that we have talked about, executing at the country level, and evaluating what are the impact of these interventions in really achieving the goals. And then with that, I wanted to share in the next couple of slides, just very high, please be assured that this is just very, very general and very high level. I just wanted to share with you little things here. But in this roadmap for 2030, we conducted this survey. 21 countries in Latin America received the survey. 13 were FIP members, 8 were not FIP members, and we had a 71 response rate. And you see here the countries that responded to the survey. Next slide. And one of the things that we have started to see is to develop kind of a vision and understand what's happening in the Americas. So I wanted to share with you only 2 slides. And what we see is in these 2 slides that, again, there are some countries that have a lot of schools of pharmacy, but we also see that we're starting to emerge, right? A look that there is a need for workforce development. So we see great variability if you look at a country like Brazil and you look at a country like Guatemala. So again, we're starting to see that there are so many regional differences. Next slide. And then we also see that when we look at workforce development, schools of pharmacy, we also see tremendous discrepancies, as you see in this slide, where you have a country like Brazil with 773 schools of faculties of pharmacy, and then you have a country like Uruguay that only has 1, and it only really has 40 pharmacists a year. Next slide. We also saw a variety of issues related to education. And one of the things that we see here is the countries that responded, 80% of them included communication, 80% included some type of research, investigation in the curriculum. But look at how it goes down when we start talking about pharmacy practice and interprofessional education. We see the numbers really drop. So again, my purpose here, next slide, was really to highlight to you a little bit of what we're doing in terms, the next slide, please, in terms of what is happening, and really assure to you that we're collecting this very, very, very important information that we will share with the Center and other stakeholders, but really the commitment of the forum to pharmacy education, and particularly to this effort in the Center. Thank you very much.
Thank you so much, Magaly, and thank you for sharing that preliminary data that really is showing the diversity and the variability that is there within the region of the Americas. And now to the moment we've been building up to, and it's now my honor to welcome Professor Silvana Leite, one of the co-chairs for the Center for Excellence in the region of the Americas. She will be supported by Professor Peter Swan from the University of Florida, who I shall introduce later. Professor Leite is a professor at the Federal University of Santa Catarina, Brazil. Her work focuses mainly on public health, pharmaceutical education, social pharmacy, and policy. She also directs the National Postgraduate Program in Pharmaceutical Services and Policies and serves as a National Health Advisor and CONITEC member. She has greatly contributed to the FIP AIM Advisory Committee, ACPE's International Services Advisory Group, and the Nanjing Statements revision that happened recently. Welcome, Silvana, and to launch the center.
Thank you, Genuine. I don't know if you can see me now.
I cannot see you, but I can hear you.
I don't know why, but I can't. Maybe now. So thank you. Thank you very much. So I would like to start thanking Genuine, and thank you, Professor John Pieper and Professor Magaly Rodrigues, for the great overview of the Americas scenario that we just heard. So greeting dear American colleagues who is watching this webinar this morning. It's with a great pride we can mark today the official launch of the FIP-UNESCO Center for Excellence in Americas region. We all have been following the FIP's great efforts to improve the quality of pharmaceutical education and the development of the FIP-UNESCO initiative in other regions. And in recent years, we have discussed the establishment of a Center of Excellence also here in the Americas. During the preparation to this launch, we have insightful discussions with colleagues representing the region of the Americas, both the North, Central, and South America, highlighting our important diversities, as we just heard, our weakness, but also the great potential that the region presents in terms of growth of the pharmaceutical workforce and the scope of practice of pharmacists, with education and policies to support the pharmaceutical workforce as the main driving force. It was a useful process, and I would like to express my sincere gratitude to my colleagues from FIP for their trust and encouragement in appointing me as a co-chair of this initiative in partnership with Professor Peter Swan from the University of Florida. This launch marks a milestone for the collaboration between the academic institutions within the America and the professional and educational representative bodies from our countries and our region. The project begins with the pharmacy schools that are affiliated to the FIP as academic institutional members. At this time, we have a large concentration of schools from the North already affiliated and some institutions from the South and Central America. We are inviting schools from schools of pharmacy, particularly from Central and South America, to come together. And many colleagues that are currently watching us here today are preparing their universities to join the project. Within the schools already affiliated, we can point out some examples. The next slide, please, the Florida University. So in the Florida University, we can highlight some areas of proficiency. So they express the proficiency artificial intelligence in teaching and research, for example, clinical and practice innovation, and research is spinning for the full drugs life cycle. That's very interesting. I would like to highlight one of the potential transformation areas that they mentioned, the translational and implementation science as an important transformation area. The next one, please. So the next is the university where I teach, the Federal University of Santa Catarina, that's based on South Brazil in Florianópolis. I would like to highlight the integrating research and training undergraduation to post-graduation. We offer bachelor, master, and PhD programs with 2 post-graduation programs. One of them focus on pharmaceutical science, and the other one focus on pharmaceutical policies and services. We have great opportunities in experiential learning. We host an pharmacy in our university that is linked to the public health system, and a huge university hospital as well, and agreements with industries and health services in our region. We have expertise from the health and pharmaceutical policies evaluation to pharmaceutical technology, nanotechnology, natural products, clinical biology, and others. As a potential transformation area, I would like to highlight to promote the development and dissemination of evidence for policies development related to health systems, professional education, and training. The next one, please, Janine. So Iowa Pharmacy, they highlighted some areas of proficiency like pharmaceutical manufacturing, community pharmacy practice, health services research, and entrepreneurship. And I would like to highlight the potential transformation area of the clinical practice transformation. The next one. The School of Pharmacy of the University of Puerto Rico. They express the proficiency in interprofessional education. That's a very important point. Experiential education, competency-based education, and clinical orientation of the curriculum. And I would highlight the potential transformation area, the capacity to collaborate in bilingual Spanish and English environment. And I would like to say maybe the next years in Portuguese as well, because in Americas, only Brazil speaks Portuguese. So we are quite isolated in terms of language. So I think this is the last one. These examples from a small sample of the involved schools can demonstrate the great opportunity of networking, collaboration, and sharing of practice across institutions and across the region. The FIP projects, the reports, the training programs already available are important tools, and we can adapt to our region and adopt start points to promote partnership and engagement to respond effectively to regional challenges and accelerate progress in pharmacy education and practice in the Americas. I finish here inviting our colleagues to join this initiative and be a partner in the Center of Excellence in the Americas. On behalf of the American institutions and pharmacists, I would like to thank FIP and UNESCO for this initiative and to make it possible. So back to you, Genuine.
Thank you so much, Silvana, for that amazing speech and those remarks, and highlighting some of the areas that our institutions can bring value to the UNITWIN Center for Excellence in the Americas. It is now my honor to welcome Professor Peter Swan, who is going to be the moderator of our panel discussion today. Professor Swan is a professor and dean at the University of Florida College of Pharmacy. He earned his pharmacy degree and PhD from the University of Utrecht and completed a postdoctorate at UCSF. He has published over 150 papers on drug transport, pharmacokinetics, and innovative drug delivery. Professor Swan, you are welcome together with all the other speakers and panelists. I'll kindly ask that you turn on your cameras as well as your microphones, and we welcome all our participants to share any questions that you may have in the Q&A tool, and we will field some of them for our speakers today. Professor Swan, the floor is yours.
All right, thank you for the introduction, and thank you, Silvana, for outlining the plans for the start of the center. I'm very excited to be here. I have a list of questions that I am going to, ask the panelists here to kind of highlight what the Center for Excellence really entails. So the first question, and I'm going to ask Magaly the first question first, and then I'll move over to other panelists. So what does the transformation of pharmacy education and science mean to the Americas, and how will that guide the American Center for Excellence?
Yeah, thank you, Peter, for the question. And I alluded to some of these in my presentation about the work of the forum, but I think that right now, in our perspective, one of the most important things in transforming, science and education also has to do with changing the legislative framework that occurs in many of the countries. I think one of the things that we see is that there's so much variety among what a pharmacist can do, what are the requirements for pharmacy education, things like even accreditation standards across the region is very, very variable. And I think that to be able to achieve the things that we want with the center, we really need to focus on how do we work with governments, with ministers of health, with regulatory agencies in the region, and with PAHO, which is very influential in the area, to really make sure that we transform legislatively and regulatory the work of the pharmacists, and particularly, we're very, very focused on the presence of the pharmacist in the pharmacies, because if you don't have a pharmacist present, doesn't matter what we do, we're not going to achieve the goals. So if I had to summarize, that to me is like the number one transformation that must occur.
I think that's a really great point, Magaly, and thank you for that, because I think legislative and especially the role of pharmacists and how it's transforming the healthcare system in general is really important. I'm going to pass the same question on to Dr. Giovanni Poletti. And Giovanni, can you please introduce yourself very briefly, who you are and where you're at? Thanks.
Thanks, Peter, and hello, everyone. My name is Giovanni Poletti, and I'm currently the chair of the FIP Board of Pharmaceutical Sciences. I'm also a faculty member at the St. Louis College of Pharmacy in the U.S. Thanks for involving me in this question. I think I agree with Magaly that legislation is certainly an important aspect. However, we all know legislation doesn't change from today to tomorrow. So it's a long-term process, and it would require some time. And when you think about the pharmaceutical sciences, I think it's not only what the pharmacist can do, it's also how drugs and drug products and medical devices, for that matter, are approved. And across the region is vastly different. FIP, with support from the Pharmaceutical Sciences Board, has worked together for the last 15 years with the WHO to understand what we can do to assist in accelerating, for example, generic drug approval. So looking at different regulatory pathways, what kind of scientific evidence is necessary to do that. And I think that's another area that we can work together across the region to fulfill some of the expectations and facilitate then the work of the pharmacist with direct patient care.
Thank you, Giovanni. It's a great point. And I think harmonization of the approval process across nations is also really important, because that will move the profession forward, right? So I'm also looking at the time here. So I'm going to make sure that we all get our say in things, but I'm going to move on to the next question. And the next question is, how can the Center for Excellence ensure equity in leadership and representation across North, Central, and South America, given the vast disparities in resources, education systems, and workforce distribution in the Americas region? And for that, I'd like to call on Dr. Wanda Maldonado to provide an answer. And can you introduce yourself too, please, Wanda?
Hi, thank you, Peter. Good morning or good evening to everybody. Certainly, we have to take a look back at what we want to achieve through this center and how do we create a roadmap for equitable and representative engagement of the different countries in this initiative. So I would like to think that what was mentioned previously in terms of, critical aspects, certainly the regulatory aspect is important. Well, we have to make sure that we are convinced, the regulators, the pharmacists, the educational institutions, that we want to go in a direction that is one that favors the outcome of patients through the region. Much too often we think of patients' needs to be different because of different countries, when patient needs are essentially the same for all. However, we have to develop processes whereby the educational process is in tune with the needs for the population, and that it can be a representative aspect that can be met with it. So certainly we need to work on how do we assure that we have the equitable part of it.
Thank you, Wanda, for that answer. And I'd like to extend the same question to Dr. John Pieper.
I think that assuring equity across the center is a critical issue, and as has been pointed out by Magaly and all of us, I mean, there are great vast differences between North America, Central and South America, and it's really a highly diverse area. I'm hoping the center, and I had mentioned this briefly, is going to be able to develop, and I think there's a question in the Q&A from Pierre Moreau from Canada as well. I mean, what has worked well in the other centers has been the establishment of an executive committee that is representative of the different regions within the center. And so as we have had some initial thinking about this, and I had mentioned, certainly collaborations between AACP, AFPC, the Pan American Conference for Pharmacy Education, COIFA, and other associations of faculties of pharmacy would be represented on an executive committee of this center. And also there needs to be very close collaboration between this Center of Excellence and the regional forum. And I think Magaly did a nice job of describing the objectives and the structure of the oldest regional forum, which is the Pan American Health Organization Regional Forum, and a very close collaboration between the forum and the Centers of Excellence. This is now working well in the Western Pacific region, where their regional forum and the Center of Excellence is working closely, same for Southeast Asia. And I think we've learned from that experience that having this close collaboration between the regional forum, the FIP's regional forum, and the Centers of Excellence is critical to make sure that all voices are heard, that diversity is recognized, and that representation is critical for the success of this center.
Thank you, John. And since you mentioned the question by Pierre, which is, how will the work of the center and the forum be coordinated, and how can synergies be created? And I'd like to extend that to Silvana first, to address that question. How can we really create these synergies? How do we work together? What are some of the plans on communicating and coordinating the center?
Thank you, Peter. Thank you for the question. So I think in our region, as we have discussed it for a long time, we have no culture of engage the universities or the schools of pharmacy together in the same project. So the Forum of Americas has an important work for a long time, working on this engagement of the representatives from our countries, and they have great data, for example, that Professor Magaly have showed us. But I think you need more initiatives that can bring together more universities, more colleagues from the university, for professors and other collaborators. So we have initiatives that can stimulate the professors and the institutions to come together. And I think the FIP-UNESCO project has an important appeal, something that people will be interested to engage with. I really think that's an opportunity to engage more institutions, and with the Forum of Americas together, we can work in joint projects, joint initiatives with a greater representation in the region, particularly in Central and South America.
Yeah, thank you. And I think that also answers the question of equity, right? That we want to make sure that everyone can participate and that it is open to all. And I think that's really important for a successful start and a successful center to begin with. So the next question is, how can the center build structured partnerships with regional organizations to strengthen collective influence and avoid duplication of effort? And I'm going to ask that question to Lilian.
Thank you, Peter, for sharing this. I've heard the comments put forward earlier, and I believe that what's going to be important is that one takes the advantage of the diversity, because that's a richness that we should appreciate, and then, however, not to reach a goal and to provide a hard outcome that is of value not only to the Americas but to the other regions, is that I suggest that there is a prioritization on which areas one is going to work on. We've heard a lot of examples that one could tackle. It's generic medicines, medical devices, the way that pharmacists practice. But I think one of the key areas is going to be that we prioritize, that there is prioritization on areas that the center is going to work with. And then after that, once that prioritization happens and the work starts happening, then with those areas of concentration, to link up with the regional organizations and also the other networks within FIP that are interested and working in that area, including curriculum development, linking up with professional organizations and the regional organizations with regards to scope of practices, and handing in this information that's being collected to these associations and to the regional partners. And hence, I also I think that how can this be achieved? Through dialogue, ensuring that in the board, in the committee, that there is a dialogue that is open to the different regions, not only in the region but also on a global level.
Yeah, that's great. Thank you. Thank you for that answer, Lilian. And you know, it's basically what you're saying is like together we're stronger, right? And so the center can coordinate these initiatives that will benefit the members. So John, can you also do you want to weigh in on that question as well about what the center can do?
Yeah, I think the center has a great opportunity because there's already some established, programs. Magaly describes, the Pan American Conference on Pharmaceutical Education has already done some roadmap work and has already kind of established some strategies in Central and South America. I know the same thing has happened in the US and Canada. So I think this center is an opportunity to bring together all these resources, prioritize projects, and I would strongly encourage identifying a couple of projects that can be successful early on of twinning, and take that as an example to be able to demonstrate to other regional partners, the regional forum, other universities about the success of a twinning project or two or three. And I think Magaly, I think you would agree that that could be a good initial start. Let's pick a couple of areas where we can take a university, faculty of pharmacy in North America, twinning with a school in South America, twinning with an institution in Central America, working on, you know, the priorities that you've laid out for the regional forum. And I think that early wins are important to get these centers going. And that's been demonstrated in the Western Pacific and Southeast Asia. Southeast Asia focused on competency development. Western Pacific took a very different approach. They're focusing on patient safety and falsified medications. And so that's their priority. So I think, but they've been successful because they've identified a couple of things that they've been able to get agreement and make progress around. And I think that's going to be critically important.
I think you're right, John, and that will set a good example for other institutions to join or to also become, you know, members of the center and start working together with other universities. We have a few minutes left, so I have one other question. So, and the question is, which emerging needs and or priorities identified in a strategic roadmap do you think are most critical to best prepare pharmacists in the Americas for the future of practice? And I'd like to ask one, if you can address that question.
Yes. Hi. Let me get this. So thank you, Peter. And certainly there are priorities that are critical. I believe that expanding the pharmacy scope of practice and securing the regulatory alignment within the region is a priority, because if we don't have an alignment in terms of what will we expect from our pharmacists in their practice, then we will not be able to implement the curricular changes that will drive that, you know, education is aligned with practice, what is expected from the pharmacist. And we will have to invest in sustained leadership and faculty development to drive those changes. Certainly we need leadership development for our pharmacists, leadership development for educational institutions, and to improve that issue of workforce capacity, where there's a perceived shortage of pharmacists in the scenarios where pharmacists are expected to perform. We have, I think, a misalignment in terms of where the pharmacists in many countries go to practice versus what is needed from the patients. So that alignment needs to be addressed too. You know, what is a perceived scenario? Where is the need for pharmacists to be?
Exactly. No, that's a great answer. Well, I am being told by Genuine, who's probably going to come online and kick me off, that we are quickly running out of time. So Genuine, if you, I want to thank all the panelists for their thoughtful answers, and I want to bring Genuine back online to finalize the presentations. Or is Dalia going to?
Thank you so much, Peter. Thank you. Thanks a million. My name is Dalia Burgess, and it gives me great pleasure as Head of Programs and Provision to just provide the final remarks on this really enlightening conversation. I'd like to thank, on behalf of FIP, all of our esteemed guests and panelists, and the over 450 participants that were live with us online for their engagement in the chat box and in the Q&A box as well. I hope that we did you well by answering some of those questions, and I will provide some general remarks just to support with the Q&As that we did not get to answer, Peter, very quickly, just to satisfy our attendees. And that you will find out more about the Center for Excellence in the Americas from FIP communication channels. And all of our academic institutional members in the region will be invited to join the Center for Excellence automatically. And if you are from an academic institution or a school of pharmacy and you're not sure if you are an AIM, please do check in with your institution or write to us, and we invite you to consider joining the FIP family to be part of this exciting journey ahead. As our esteemed guests have reflected on the importance of equitable and sustainable development of education and science across the various nations in this region, they've honed in on the importance of representation, collaboration, dialogue, and the importance of the alignment between education and practice and the regulatory framework. And with that, FIP is committed through the Center for Excellence to facilitate this dialogue, as Lilian already mentioned. And we are committed to bringing together our affiliated associations from the region who represent schools of pharmacy, along with our members and colleagues, to really help FIP on a global scale advance pharmacy worldwide through education and science in this particular realm. So again, thank you so much, colleagues, for being with us. Thank you so much for the launch. Congratulations to you all. Looking forward to supporting the meetings next year, and for us to all learn alongside you and with you. And with that, I believe I also have some final housekeeping and announcements from FIP to share with our participants, if I may. You can find out more about the UNITWIN program from our website, and you're welcome to scan the QR code. Thank you. And to listen to the recording after this and to even watch other recordings from FIP, you are welcome to visit events@fip.org. And remember to be part of the FIP Global Membership family, and we would invite you to really find out about individual membership benefits as well as organizational membership benefits by visiting our website. And if you have any questions, do write to us. And we would love for you to consider joining us in the 84th FIP World Congress of Pharmacy and Pharmaceutical Sciences in Montreal, Canada. And so if you've not heard of it before today, do have a look at our information on the website. And the overarching theme for 2026 is One Health, One Pharmacy, Bridging Science and Education. How relevant is this to the establishment of the center today? We have also 3 very important sub-themes around integrated health, innovative with purpose, and collaborating for equity. These are very important dates for you to consider if you're looking at submitting abstracts and joining the scholarly research and speakers sessions. And would like to also conclude by reminding you all of our overarching campaign at FIP, and that is, whenever you think about health, you should think about pharmacy, and that is us being professional, available, and trusted. Thank you so much for supporting this work and supporting FIP. And good day, good evening to you all. Stay safe and well.